the US-based scientist, molecular biologist Dr. Lindsay makes inaccurate claims on COVID-19 vaccine safety. An American scientist claims that the COVID-19 vaccines pose safety concerns, including sterilization and changes to DNA, in remarks shared on social media. But experts and public health bodies say there is no evidence that mRNA shots are causing reproductive problems and are not modifying the genes of recipients. Molecular biologist Dr. Jancy Chun Lindsay, "We could be sterilizing an entire generation." She further added, she feels strongly that the inoculations must be halted immediately due to safety concerns on several fronts. Countries around the world are seeking to immunize their populations against COVID-19, which has killed more than 3.3 million people. But false claims about the vaccines are spreading across the internet, despite efforts by social media companies to stop them, and assurances from health authorities that the shots are safe and effective. More than 261 million COVID-19 vaccine doses have been administered in the United States. Most were Pfizer's and Moderna's mRNA vaccines, though a shot from Johnson & Johnson that uses different technology is also being used. Lindsay further claims that there is credible reason to believe that the COVID vaccines will cross-react with the syncytin and reproductive proteins in sperm, ova, and placenta, and lead to impaired fertility and reproductive outcomes. But there is no evidence that they do, according to multiple experts. The CDC says that there is currently no evidence that any vaccines, including COVID-19 vaccines, cause fertility problems. In a joint statement, the American College of Obstetricians and Gynecologists, the American Society for Reproductive Medicine, and the Society for Maternal-Fetal Medicine also said that there is no evidence that the vaccine can lead to loss of fertility. Lindsay also claims that as of early April, we have seen 100 pregnancy losses, and we have heard multiple reports of menses irregularities in those vaccinated. But there is no current indication that COVID-19 vaccines negatively affect women's pregnancies, according to experts and public health bodies. The CDC said in February that it had not identified any trends of miscarriages following COVID-19 immunization. To date, no evidence has indicated an increase in miscarriages after COVID-19 vaccines, and no concerning patterns of reporting have been observed, a spokesperson said. An official description of VAERS, which is run by the CDC and the U.S. Food and Drug Administration, FDA, says it contains information on unverified reports of adverse events, illnesses, health problems, and/or symptoms following immunization with U.S. licensed vaccines, and that it accepts reports from anyone. There have been reports of blood clots associated with low platelets following vaccination with the adenoviral, non-mRNA vaccines from Johnson & Johnson, Janssen, and Oxford AstraZeneca. But these events are very rare. The US paused delivery of the Johnson & Johnson shots because of blood clot concerns, but the CDC and FDA recommended they resume after data showed 23 confirmed reports of thrombocytopenia syndrome, TTS, which involves blood clots with low platelets, out of more than 8.4 million doses administered. If you like the report and want to stay up to date on the latest events around the world, please like, share and subscribe the RT News Wire channel and click the bell notification to get latest updates as it happens.